Today we're having an important conversation that every woman should hear: how chlamydia affects women's health. Chlamydia is one of the most common sexually transmitted infections, and the truth is many women who have it don't even know. So whether you're sexually active or just curious about protecting your health, this video is for you. Let's dive in. Chlamydia is a bacterial infection that's spread through sexual contact, and it's particularly important for women to know about. The infection is caused by Chlamydia trachomatis, and while it doesn't often show any symptoms, it can lead to serious health issues if left untreated. It's one of those infections that can fly under the radar, but it's not something to take lightly. Chlamydia can be passed on through vaginal, anal or oral sex, even if your partner doesn't have any symptoms, or if you don't. Chlamydia can still be present, and that's the tricky part. You may not realize you're infected, and neither does your partner, which is why regular testing is so important. It's easy to think it won't happen to me, but the truth is, chlamydia is more common than you might think. Here's why chlamydia is especially important for women. If left untreated, it can cause pelvic inflammatory disease, PID, which can lead to long-term complications like chronic pelvic pain, damage to the fallopian tubes, and even infertility. PID is no joke. It can create scarring to the reproductive system, which makes it harder to get pregnant in the future. And for pregnant women, chlamydia can lead to complications, including passing the infection to your baby during delivery. While many women don't have symptoms, some do experience signs like abnormal vaginal discharge, pain during sex, or bleeding between periods. These symptoms can be easy to miss or confused with other issues, which is why getting tested regularly is crucial. Don't wait for symptoms to show up. Take control of your sexual health. Get tested. Chlamydia is incredibly common, especially among women between the ages of 15 and 24. In fact, young women are at high risk of contracting it, partly due to the biology of the cervix, which is more susceptible to infection in younger women, and every year worldwide there are millions of cases of chlamydia. Getting tested for chlamydia is quick and simple, and it is a normal part of taking care of health. For women, testing usually involves a swab of the cervix during a pelvic exam or a urine test. The test is painless, and if you're sexually active, especially with new or multiple partners, it's a good idea to get tested regularly. Early detection is key to avoiding complications. The good news is chlamydia is easily treated with antibiotics. If you test positive, your healthcare provider will provide you with a course of antibiotics that usually clears the infection in about a week. During treatment, you'll want to avoid sexual activity to prevent reinfection or passing it on to your partner. And remember, your partner will need to be treated as well to make sure you don't keep on passing the infection back and forth. Prevention is always better than treatment, so using condoms consistently and correctly is one of the best ways to protect yourself from chlamydia. Regular screening is also important. If you've been treated for chlamydia, it's recommended you get retested after about 3 months, even if your symptoms have gone away, to make sure the infection is completely cleared. This is especially important if you're planning to get pregnant or are already pregnant. One thing I really want to emphasize is the importance of regular STI testing. For women, it's part of being proactive about your sexual health. Even if you're in a monogamous relationship, regular testing ensures that you and your partner are both in good health. And if you're younger or have multiple partners, you may want to get tested more frequently. Knowledge is power. Knowing your status allows you to take control of your health and well-being. To sum it up, chlamydia is common, but it's preventable and treatable. For women, it's crucial to take steps to protect your reproductive health by getting tested regularly, using protection, and staying informed. If you think you might be at risk or been a while since your last STI test, schedule one today. It's a small step that will make a big difference to your future health.